So, how you breathing these days? Maybe it's a little tough to do that through your nose. Maybe sinusitis is keeping you struggling.
Or it could even be something as irritating as a runny nose that just never seems to stop. These are all conditions that the team at Eastern Shore ENT and Allergy Associates in Salisbury can tackle. But that's just the start of them. 102.5 WBOC's Leah Rizzo lays it all out for us.
Dr. Michael Kelleher of Eastern Shore ENT and Allergy Associates has a mission to help his patients breathe easy.
What determines your ability to breathe through your nose is really three areas. The nasal septum, which runs down the middle, what are called the nasal turbinates, which are the soft tissue membranes that kind of enlarge and shrink with temperature, humidity, allergy, and so forth. And then the kind of the apex of the nose, which is where air flows most rapidly.
One of those procedures uses this device.
The actual name is a radiofrequency tissue remodeling, which means that you're using energy. In this case, it's radiofrequency. There's other applications with ultrasound and so forth, but to try to make nasal membranes smaller to improve patients' ability to breathe through their nose. So this is the device, and this is where the energy is delivered.
Smaller membranes mean larger areas for air to travel.
The nice part about it is that prior to this, we would take people to the operating room and do more invasive things that took longer to heal. This, the patient comes in, we prepare the nose, we do the procedure in 20 minutes, and then they just get up and walk out. So there's no sedation or anesthesia or those kind of things.
Another procedure Dr. Kelleher does treat chronic runny nose.
It has to do with nerve endings inside the nose that are kind of overstimulating the nasal membranes to produce clear mucus. And it doesn't really respond very well to much of anything except for some topical nasal sprays. What's done here, same technology, it's radiofrequency, but it's applied further up into the nose to try to stop those little nerve bundles from kind of overdoing what they're supposed to do.
One of the most common conditions Dr. Kelleher treats is sinusitis.
So people that have recurring sinus problems is because either due to allergy or due to their anatomy, the sinuses don't get air in and mucus out.
He uses this device to insert a balloon catheter.
And this balloon, once it's in position, is dilated. So it's basically technology taken from cardiology, where for years cardiologists have dilated coronary blood vessels to prevent heart attacks.
Something you might not expect a doctor at an ear, nose, and throat practice would address: acid reflux.
Most times you would think of gastric acid reflux as being in the realm of the gastroenterologist, which is true. But we see a lot of patients who have a chronic throat clearing cough. They have a feeling like sort of a lump in the throat all the time.
That's where this little wire comes in. A probe on the end is threaded nasally.
And the tip of the probe sits right in the upper pharynx, kind of behind the little dumbbell, the uvula. And then it's it's kind of taped over here, and the patient wears it or uses it for 24 hours.
In that 24 hours, any acidity in the upper throat is measured. Treatment includes lifestyle changes combined with medication.
What you don't want people to do is to eat and then go right to bed, because that's a recipe for problems. And of course, other things like maintaining good hydration and the diet to a certain degree. But some people will have reflux regardless of what they eat or don't eat.
Dr. Kelleher is pleased with the way this new technology is allowing him to deliver care to his patients, giving them comfort and allowing them to breathe easier.
Now here's the thing about the team at Eastern Shore ENT. They are always sharing some interesting tidbits of info. Now for instance, there is a reason you might snore more during the summer. Are you intrigued?
Yes.
Now here's the deal. It is because the dry air in the summer can dry out your nasal passages.
Never even thought about that.
Right?
How about that?
I know. I hope
Wow.
I'm not snoring extra. And of course, you can just check out Eastern Shore ENT's Facebook page for more fascinating facts.